Hello and welcome to this lecture on vitamin C. I am Dr. Sambit and I will take you through this topic of vitamin C. The active forms of vitamin C are ascorbic acid and dehydroascorbic acid in the human body. The maximum body pool of vitamin C is about 1500 milligrams. The absorption of vitamin C is an energy dependent process and the transport system gets saturated. If we take about 100 milligrams of vitamin C, there is complete absorption, after which the rate of absorption decreases. At higher intake levels, there is enhanced degradation of vitamin C and there is fecal and urinary excretion. The recommended dietary allowance for vitamin C is about 60 milligrams per day for both males and females. In pregnancy, the RDA rises up to 70 milligrams per day, and in lactation slightly higher than that by 90 to 95 milligrams per day. The good dietary sources of vitamin C are citrus fruits, green vegetables. The vegetable broccoli is pretty rich in vitamin C, tomatoes, potatoes, capsicum, etc. In smokers or people having hemodialysis and in stress situations like infections or trauma, the requirement of vitamin C increases. About synthesis of vitamin C, plants and mammals are able to synthesize vitamin C, but there are exceptions. Guinea pigs and primates, including us humans, cannot synthesize vitamin C in the body, which means that we have to take it externally. So it becomes an essential vitamin. In organisms that can synthesize vitamin C, the source of vitamin C is the acidic sugar glucuronic acid. The enzyme that synthesizes L-ascorbic acid from glucuronic acid is L-gulonolactone oxidase, and please remember, we humans lack this enzyme. Coming to the functions of vitamin C, vitamin C acts as a reducing agent. It has a very important role as a coenzyme for important enzymes, which we shall see later on. In that capacity, vitamin C helps maintain the normal connective tissue. It helps in wound healing. Vitamin C is responsible for dietary absorption of iron. Vitamin C is an important antioxidant for the human body. It also is involved in drug metabolism as a part of mixed function oxidase system. We shall now move on to vitamin C and its relation to the very important protein collagen. Collagen, you must know, is one of the most abundant proteins in the human body. Right from a very hard tendon to the vitreous humor in the eye, collagen is widely found. The structure of protein collagen is a rope-like triple helix. There are more than 25 types of collagen in the human body. The biosynthesis of collagen in the human body has these following steps. Firstly, there is formation of pro-alpha chains which undergo hydroxylation, and that is where vitamin C comes in, which we shall see in detail. That is followed by glycosylation. There is assembly and secretion of collagen because it has to go to the extracellular space. Then in the extracellular space, there is cleavage of procollagen that happens. Then the collagen fibril is formed, and finally the cross-linking step happens, which gives collagen its characteristic strength. For vitamin C, we will focus on the hydroxylation step of collagen biosynthesis. So this happens in the lumen of the rough endoplasmic reticulum. The collagen protein structure is a repeated units of glycine XY, where the position Y is taken by lysine or proline. So these two unique amino acids undergo the process of hydroxylation and form hydroxyproline and hydroxylysine, the two very important things which ultimately go on to help in cross-linking and giving collagen the strength it needs. The enzyme that carries out this function are prolyl hydroxylase and lysyl hydroxylase. These enzymes need three important things. They need molecular oxygen, iron, and importantly vitamin C. So, if there is absence of vitamin C, what happens is there is impaired interchain hydrogen bond formation, because of which the triple helix is unstable, which ultimately goes on to affect the cross-linking of collagen fibrils, and that results in decreased tensile strength of collagen, which is its USP. And the disease that is related with this is scurvy, which of course we shall see in much detail in a while. Apart than playing a major role in collagen biosynthesis, vitamin C is involved in many metabolic reactions in the human body. We shall just see a couple of them. The first would be the role of vitamin C in neurotransmitter synthesis. Norepinephrine, very important neurotransmitter, requires vitamin C for its production. When dopamine is converted to norepinephrine by the enzyme dopamine beta hydroxylase, it requires vitamin C and copper. Apart than this, carnitine which is essential for fatty acid transport in the carnitine shuttle, also requires vitamin C. Apart than these, vitamin C is involved in many other metabolic pathways, including cholesterol biosynthesis. Now, let us see how vitamin C functions as an antioxidant. Vitamin C, as we initially had seen, is able to donate electrons. So what happens is they quench the reactive oxygen species, which are oxidants, and therefore act as an antioxidant. Not just that, vitamin C is also involved in the regeneration of other important antioxidants like vitamin E, flavonoids, and glutathione. You would remember glutathione is a very important antioxidant which helps maintain the RBC membrane integrity. In the antioxidant role of vitamin C, it helps prevent the oxidation of LDL, low density lipoprotein, which can lead to things like myocardial infarction. Let us now move to the deficiency manifestations of vitamin C. It is usually observed in the poor and elderly people and alcoholics who consume less than 10 milligrams per day. It can also be seen in people who follow a macrobiotic diet, which is very restrictive. The disorder associated with vitamin C is scurvy, and scurvy is often observed only when the body pool, which is normally 1500 milligrams, falls down to less than 300 milligrams per day, or alternatively, the plasma levels fall to less than 11 millimoles per liter. As we had seen in the case of collagen, scurvy is seen when there is impaired formation of mature connective tissue and the symptoms are associated accordingly. For example, bleeding into the skin, petechiae, that is because of the rupture of the fine capillaries on the skin which contain collagen type 3. So, an impaired formation of collagen type 3 could lead to these issues. Inflamed and bleeding gums, a very characteristic feature. Often sailors or pirates in movies are projected with these features, because as this story goes, it was in the 1700s that English sailors used to have symptoms of scurvy. Now, the captain of the ship, famous Captain James, he divided the sailors into two groups. One of the groups got lemon to eat and the other did not. The symptoms remarkably improved in the group that got lemons, and since then sailors used to carry a lot of lime as they went in the sea for months together. So, coming back to the symptoms of scurvy, the other manifestations of scurvy could be when the bleeding happens into the joints or in the peritoneal cavity, in the pericardium and adrenal glands. The other general features of scurvy are weakness, fatigue and even depression. The treatment is pretty straightforward. Administration of vitamin C up to 200 milligrams per day remarkably improves the signs and symptoms of scurvy. About the toxicity of vitamin C, if consumed in dosage of more than 3 grams per day, then we see an elevated levels of alanine aminotransferase, lactic acid dehydrogenase and even uric acid in the body. A very high dose supplementation of vitamin C carries the risk of oxalate kidney stones. The reason being vitamin C is metabolized to oxalate in the body. There is also a possible risk of iron overload, since vitamin C aids in increased iron absorption in patients who take supplemental iron. So, that summarizes vitamin C for us. As we have seen, vitamin C is an important vitamin in the body because it helps in synthesis of the most abundant protein in the body, collagen. Vitamin C has a very important antioxidant function in the body, and the deficiency disorder of vitamin C is scurvy, which is related to the impaired formation of collagen, and thus the impaired formation of connective tissue causes the symptoms of scurvy. That's it for today. Thank you.